This is Chapter 20, Module 1, Anatomy of the Heart and Blood Flow. The learning objectives of this module are 1. Describe the anatomy of the heart, including identifying the major blood vessels, chambers, and heart valves. 2. Describe the flow of blood through the heart. And 3. Describe the coronary circulation and the pericardium structure. The cardiovascular system contains 2 circuits of blood vessels that carry blood to and from the heart. The pulmonary circuit carries blood between the heart and lungs, and the systemic circuit carries blood between the heart and body tissues. Within the cardiovascular system are 3 types of vessels. Arteries always carry blood away from the heart, veins always carry blood to the heart, and capillaries are networks of tiny blood vessels between the arteries and veins, where exchange of materials such as gases, nutrients, and waste products occurs. The systemic arteries leaving the heart branch into smaller vessels that become capillaries, and the capillaries converge to form systemic veins that return blood to the heart. The systemic arteries leaving the heart contain a high concentration of oxygen that will be carried to the tissues of the body. These systemic arteries are part of the systemic circuit. The blood they carry appears bright red since it is delivering oxygen to body tissues. After the arteries branch into capillary networks, the oxygen diffuses out of the blood and is delivered to the tissues. The capillaries converge to form systemic veins that return the now deoxygenated blood and now darker blood, signified by the color blue, back to the heart. In contrast, the pulmonary arteries carrying the blood to the lungs through the pulmonary circuit are carrying deoxygenated blood from the right ventricle. This blood is dark and is signified by the color blue. When the arteries reach the lungs, they branch into capillary networks where oxygen can diffuse into the blood. The now bright red oxygenated blood in the capillaries will travel back to the heart through the pulmonary veins. The heart itself is a hollow muscle. There are 3 layers of tissues in the heart wall: the epicardium, a connective tissue, the myocardium, a muscle tissue, and an endocardium, an epithelial tissue. The epicardium is also considered the visceral pericardium. The myocardium is the muscular wall of the heart. It contains concentric layers of cardiac muscle. The endocardium is a simple squamous epithelium that lines the chambers of the heart. There are 4 chambers within the heart: the right atrium that collects blood from the systemic circuit, the right ventricle that pumps blood to the pulmonary circuit, the left atrium that collects blood from the pulmonary circuit, and the left ventricle that pumps blood to the systemic circuit. The superior portion of the heart is called the base. Great, meaning large veins, and arteries extend from the base. At the inferior end of the heart is the apex, where the heart narrows to a pointed tip. The heart is surrounded by a pericardial sac that sits between the 2 pleural cavities in the mediastinum. The pericardium is a double lining of the pericardial cavity. The visceral pericardium is the inner layer of the pericardium, and the parietal pericardium is the outer layer of the pericardium. The pericardial sac surrounds the parietal pericardium and stabilizes the heart. Between the parietal and visceral layers of the pericardium is a fluid called the pericardial fluid. This fluid helps to reduce friction between the heart and surrounding tissues during contractions. The outer area of the atria are expandable and are called auricles. These auricles allow expansion of the atria as needed. The atria have thinner walls than the ventricles. An indentation called the coronary sulcus divides the atria and ventricles. Indentations called the anterior interventricular sulcus on the anterior side of the heart and the posterior interventricular sulcus on the posterior side of the heart separate the left and right ventricles. They contain blood vessels that supply the cardiac muscle tissue. The right atrium receives blood from the superior vena cava, the inferior vena cava, and the coronary sinus. The superior vena cava returns blood from the head, neck, upper limbs, and chest. The inferior vena cava returns blood from the trunk, viscera, and lower limbs. The coronary sinus returns blood from the coronary sinus that receives blood from the cardiac veins. The cardiac tissue between the right and left sides of the heart forms septums. The septum between the right and left atria is called the interatrial septum. The septum between the right and left ventricles is called the interventricular septum. During development prior to birth, there is an opening in the interatrial septum between the right and left atrium. This opening is called the Foramen Ovale. The Foramen Ovale seals off before birth and forms an indentation or remnant called the fossa ovalis. An opening in the right atrium leads into the right ventricle. A valve called the right atrioventricular or AV valve, also called the tricuspid valve, is attached to this opening. The tricuspid valve has 3 cusps that are attached to cords called the chordae tendineae. The chordae tendineae attach to papillary muscles that attach to the walls of the ventricles. The chordae tendineae and the papillary muscles prevent the tricuspid valve from prolapsing into the atria and therefore prevent the backward flow of blood. A major blood vessel called the pulmonary trunk exits from the right ventricle superiorly. The pulmonary trunk divides into the right and left pulmonary arteries. The opening where the pulmonary trunk begins on the right ventricle is covered by a semilunar valve called the pulmonary valve. The pulmonary valve has 3 semilunar cusps. The pulmonary arteries deliver blood to the lungs, where they will pick up oxygen and drop off carbon dioxide. The blood vessels leaving the lungs are called the pulmonary veins. Blood from the lungs gathers into the left and right pulmonary veins that delivers the blood to the left atrium. From the left atrium, the blood passes through an opening into the left ventricle. The opening is covered by a valve called the left atrioventricular valve or the left AV valve. The AV valve has 2 cusps and will be referred to as the bicuspid valve or the mitral valve. The left ventricle has the same volume as the right ventricle. However, the left ventricle has thicker and more powerful muscles than the right ventricle because it must deliver blood to the far ends of the body, whereas the right ventricle only has to deliver blood to the lungs. From the left ventricle, blood leaves through the aorta. A semilunar valve called the aortic valve covers the opening between the left ventricle and the aorta. The initial portion of the aorta ascends superiorly and is called the ascending aorta. The ascending aorta turns and forms the aortic arch. The aortic arch turns again to descend through the thoracic cavity. The portion of the aorta descending through the thoracic cavity is called the descending aorta or the thoracic aorta. In summary, there are 2 atrioventricular valves. The AV valve between the right atrium and the right ventricle is called the right AV valve or tricuspid valve, and the AV valve between the left atrium and the left ventricle is called the left AV valve or bicuspid valve, or mitral valve. Blood pressure will open and close the valves depending on which side the greater pressure is at. The papillary muscles tense the chordae tendineae and prevent the AV valves from swinging into the atria. There are also 2 semilunar valves. The pulmonary semilunar valve prevents backward flow of blood from the pulmonary trunk back into the right ventricle, and the aortic semilunar valve prevents the backflow of blood from the aorta back into the left ventricle. The semilunar valves do not have muscular support from the papillary muscles like the AV valves do. Instead, the 3 cusps from the semilunar valves support more like a tripod to prevent the backflow of blood. Heart tissue is like all other tissues in that it needs to receive its own blood supply in order to survive. It needs oxygen and nutrients, and it needs to get rid of waste products. The coronary circulation contains small blood vessels that supply blood to the muscle tissue of the heart. The vessels in the coronary circulation are called the coronary arteries and the cardiac veins. The coronary arteries originate at the base of the aorta. There is a right and a left coronary artery to supply the heart. The right coronary artery supplies blood to the right atrium and portions of both ventricles. It branches into the marginal arteries and the posterior interventricular artery. The left coronary artery supplies blood to the left ventricle, left atrium, and the interventricular septum. There are 2 main branches of the left coronary artery, the circumflex artery and the anterior interventricular artery. The cardiac veins receive the blood from the coronary arteries and return it to the right atrium. The great cardiac vein drains blood into the coronary sinus, that drains blood into the right atrium. The anterior cardiac veins empty directly into the right atrium. The posterior cardiac vein, the middle cardiac vein, and the small cardiac vein empty into the great cardiac vein that empties into the coronary sinus. Heart disease or coronary artery disease is when there is a partial or complete blockage of a vessel in the coronary circulation. The cardiac muscles need a constant supply of oxygen and nutrients. Without this constant supply, the performance of the cardiac muscle will suffer. This reduction in circulation is called coronary ischemia and could result in the death of the cardiac tissue not receiving blood supply. The usual cause of heart disease is the formation of fatty deposit in the walls of coronary vessels. This fatty deposit is called an atherosclerotic plaque. The plaque forms a thrombus that narrows the passageway and reduces the blood flow to the coronary tissue. Spasms in the smooth muscles of the vessel walls further decrease or stop the blood flow. One of the first symptoms of coronary artery disease is angina pectoris, characterized by chest pressure and pain during physical exertion. This pain often refers from the sternum to the arms, back, and neck. A heart attack or myocardial infarction, MI, is when the blocked coronary circulation causes the affected cardiac muscles to die from the lack of oxygen. The death of the infected tissue creates a non-functional area of cardiac muscle. Heart attacks most commonly result from severe coronary artery disease. If the blockage occurs near the start of one of the coronary arteries, the damage will be widespread and the heart may stop beating. If the blockage involves one of the smaller arterial branches, the individual may survive the immediate crisis, but may have complications such as reduced strength of contractions and irregular heartbeats. An individual having a myocardial infarction experiences intense pain similar to angina, but pain that persists even when at rest. This ends Chapter 20, Module 1, Anatomy of the Heart and Blood Flow.